The low back is susceptible to injury because it bears the weight of our body. It also undergoes a lot of movement, right? Whether that's bending or twisting, lifting. And third, it is just subject to injury because of the repetitive stresses and strains that we subjected to during the course of a day. And add to this, people's bodies. So if our core isn't strong enough, if our legs aren't flexible enough, including our hips and our hamstrings and our hip flexors, all of these things make a perfect storm for why the back is injured significantly. I think it's important to focus on core strength, number one. The strength of the core and the coordination and control of the core. It's also, I think, important to work on lower extremity exercises to work on flexibility. So we need to focus on stretching out our hips, our hamstrings, our hip flexors. And if we're loose in those structures, that improves the function of the back. I think it's also important to work on posture, right? So people have very poor posture sitting. Having lumbar support while people are sitting is really important. I think it's important to talk about ergonomics for lifting, right? Keeping things close to our bodies. It's a great start to see a physician, especially in our practice as physiatrists. We know a lot about exercise prescriptions, and I will start people off commonly with a group of core exercises, perhaps a plank, a bird dog, some bridges, and that's a starting off spot. But I'm not a physical therapist, and in developing a program, I think is best for me to refer to the patient to a physical therapist who you might see a couple times a week over a course of 6 weeks or more if there's still work to be done. And over that period of time, the very simplistic exercises I start with are progressed under a true professional.